Hello, I'm Dr. Jeffrey Wood. I'm a psychologist in San Francisco, California, and today I'm going to be speaking with you for a little while about phobias, and more importantly, what's the best treatment for your phobia. So to begin with, what is a phobia? A phobia is a very intense and overwhelming fear of something very specific. For example, a lot of people have animal phobias, phobia of things like snakes and dogs. Other people have social phobias, which is a fear of being criticized or judged by other people. Some people have situational phobias, which is a fear of being in situations like riding in elevators, flying in airplanes, or driving over bridges. A little bit later on, I'm going to give you a brief example of treating someone with a fear of elevators. Now, in each situation, the person does their best to avoid these types of situations. People with phobias recognize that their fears are very overwhelming and beyond the norm. However, this insight alone isn't enough to cure you of your phobia. What you're going to need is a treatment called exposure. Exposure treatment is a form of cognitive behavioral therapy, and all the research shows that it's by and far the best treatment for your phobia. And if anyone tries to tell you differently, they're lying. So how does exposure work? Let me give you an example. First of all, here's what happens during your normal exposure to the thing you're afraid of. Your anxiety level very quickly goes up, but then what happens? You very quickly retreat from or avoid that thing, like a snake or flying or riding in a car over a bridge. Now, avoiding that might seem like a good strategy, but unfortunately this just tends to reinforce the strength of your phobia because it increases your belief that you can't cope with this thing that you're afraid of. In comparison, what exposure therapy does is it helps you maintain a very safe and systematic contact with the thing that you're afraid of. And here's what will happen over time. Your anxiety level will quickly go up just like it did last time, but if you maintain contact with the thing that you're afraid of, you'll find, I promise you, that your anxiety level will plateau and eventually it will come down. Now, there are two different types of exposure work that I'd like to talk to you about briefly. So there are two different types of exposure treatment that I'd like to talk to you about. Flooding and graded exposure. So to begin with flooding, let's take an example of a woman with a phobia of elevators. Using flooding, she would simply get on that elevator and just start riding it until her anxiety levels started to come down. Now, I know this sounds scary for a lot of people, so I don't recommend it unless you're fully committed to watching your anxiety level rise and fall. If you get off that elevator in the middle, it's just going to reinforce your phobia. So don't use this flooding unless you are fully committed to the end result, which is watching your anxiety level come down. Now, the second type of exposure is graded exposure, and it's a lot more tolerable for a lot of people, so it's the one that people usually choose, and I can understand that. So with graded exposure, what we do is we create a hierarchy list of the things that you're afraid of. So we don't start off at the top like getting in the elevator, we start off at the bottom. So this might include maybe just imagining yourself riding the elevator. That might be on the bottom. Maybe you find that's pretty tolerable, you can do that. But again, you have to watch your anxiety level come down before we move to the next step. The next step might be standing outside an elevator and watching other people ride it. Then once you're over that one, you might actually get in the elevator and ride it to the second floor, then to the third floor, and then to the fourth floor, until you finally work your way up that hierarchy list, that graded list of feared events, until you get to the top and you're finally able to ride the elevator without the fear interfering with your life. So again, in a nutshell, the purpose of exposure treatment is to help you safely and systematically confront your fears without the anxiety preventing you from doing so. I'm Dr. Jeffrey Wood. That's my little pitch about phobias. If you have any more questions, please feel free to visit my website, drjeffreywood.com. Thank you.